I'm Sonia Vermaak. On Monday, the 22nd of July, my husband had a stroke. I managed to get him to the Johannesburg Surgical Hospital within about half an hour. My husband is Leon Vermaak and he's 73 years old.
So my name is Dr. Pradeep Rauji. I'm one of the only neurologists at the hospital. I generally do everything in neurology, but I have a special interest in stroke. So the patient presented to us with an acute onset of left-sided body weakness. This is not his first stroke, and in fact, the first time around we saw him, we did something very similar. So he comes in with a left-sided hemiplegia. His wife is very aware of the need to bring the patient into hospital urgently, which was paramount even on the first occasion. And what we were able to do is reverse his stroke, which is what we'd like to do in this era, is for every single patient with a stroke, if they come in timeously, to reverse the stroke, so as to walk out without any features that you've had a stroke. He walked into the bathroom and expressed to his wife that he was unable to use his toothbrush because he couldn't get the toothpaste out of his tube of toothpaste onto the toothbrush, which immediately alerted her to the fact that there was something amiss, and immediately noticed that his face and his left side was weak, and got him to the hospital within minutes of the onset of the symptoms. He'd woken up completely well, but this was an alerting symptom for her, and she knew the symptom quite well. So I guess even if she didn't know the warning signs of a stroke, she's come to know them, and I think we've been trying our best to alert the public at large about the alerting symptoms of a stroke. We use the acronym FAST. F is for the face and A is for the arm. So if the face and arm are on the same side and there's drooping of the arm and drooping of the face, it immediately alerts you to the fact that you're dealing with a stroke patient. You also had slurring of his speech, which is the acronym S, and the last in that acronym is T, which is time. So the faster we can get our patients in for an evaluation, the safer it is, and the likely chances of reversing that stroke is obviously increased and increased to a significant amount as well. In our patient, we were able to use a medication which acts to dissolve the clot. So there's many new variations of treatment that are available. We categorize them into two types. The one is the medication type, which is a chemical that is a natural molecule that is going to break down a clot. The second one is where we use a mechanical device, and this mechanical device is a catheter-based device which we do in heart diseases already and in patients with peripheral vascular disease of the limbs, where they send up a catheter up into the brain blood vessel, hack the clot, and slowly extract it from the brain. In so doing, we get blood flow to the brain and re-establishment of neurological function. So we have two modalities. In our patient, we were in time, and so we have a very important time schedule to obey. And that schedule is that we have to do our medical therapy, that means chemical busting of the clot, within 0 to 4.5 hours. Beyond that, we have complications with the chemical agents. So we want to get your patients in here within the first hour. So important, if you see your loved one or anybody else on the street having these symptoms, get them to a health facility, because we have the golden hour in which to attend to these patients and improve their chances of fully recovering from a stroke. So one of the things that I want to emphasize is that our ED is completely set up for the emergency management of stroke. We have a full team that is ready to be able to remove that clot, and we are grateful we have the ability and the infrastructure and the knowledge to be able to offer this to all our patients at this new hospital of ours.